Welcome everybody. I just wanted to introduce to you today Rachel Zoffness, all the way from the US. I feel very privileged to be talking to her. I've been watching her work for some time now, and I think it is certainly worth knowing, and she is worth knowing about. Rachel is a pain psychologist with a PhD, a medical consultant, author and speaker. She also teaches pain education to medical research students and students alike. She serves on the board of the American Association of Pain Psychology and also founded the pediatric division. But more than anything, I think, look, your obsession and your passion, I think I would say, for teaching others and educating others about pain. And that's from all the way from academics right down to a language that even children can understand. And you've been doing it for some time. I'm really interested in you talking to us and I guess the GrowthRx community about your love for this and where it's come from, where it's going, and I guess how you can probably assist with us a little bit more in where our place is in allied health, particularly those practitioners who aren't psychologists, but certainly deal with this biopsychosocial pattern that we're starting to see evolve more and more. So yeah, tell us about yourself.
Okay, so it's sort of been a winding road as far as how I ended up here. As you probably know, most psychologists are not trained in pain because in our culture we have this strange and unhelpful distinction between physical pain or emotional pain. And it seems to be like you're either trained in one or the other, which is so infuriating because, of course, as you know, pain is biopsychosocial, so all the things affect all the things. But the question I get asked the most is pain, do you treat physical pain or emotional pain? I get that question all the time. It's so interesting. As soon as I say I'm a pain psychologist, because no one even understands what that means. So now I just nod my head and say yes, But, originally I didn't know what I wanted. I wanted to study neuroscience and medicine, and I wanted to study biology and human behavior, and I wanted to be a teacher, and I wanted to be a science writer. So I sort of went down the rabbit hole and did all the things. But my senior year, I was always a nerd. I'm still a nerd, and I read a lot. And my senior year at Brown, I was trying to figure out how to meet all of those different things. And my mentor suggested that I do my senior thesis on pain. And I just went down the rabbit hole, and I sort of never came out. I went on this winding road where I was, writing for science magazines for a while, and I was a science teacher at the Bronx Zoo in New York City, which is the best job I ever had, working with kids. And but more recently, when I decided to establish my own practice, which was about a decade ago, I really wanted to do hands-on pain work with clients and not just read about it and study it, but actually help people and put it into actual practice. So I linked up with UCSF and Stanford and started seeing a lot of their patients on an outpatient basis. But what's happening now for me is that I think it's really, really important to not just talk about the biopsychosocial model, but to really live it and be it, because as I know, we're all really siloed in our own different specialties. So PTs are over here and OTs are over here and psychologists are there and social workers and anesthesiologists and physiatrists, and we're all treating the same patients. But some of the people who come to me have seen 14 different doctors, physicians before they get to me, and they've seen however many providers on top of that. It's just so infuriating that our field is so divided. So I'm trying to bridge that gap.
And look, you say the word infuriating. What is it? Because people don't know their place and their role in pain, or people are shying away from it a little bit? Like, I mean, can we be, as manual therapists and as physical therapists, is there much more that we can actually do without having to have that psychology qualification? I think, you started an amazing initiative called the Pain Hour, and I was honoured to be a part of that last week, which is a group of leaders in pain coming together. And I certainly do not consider myself a leader in pain, but I'm very interested in learning from other people at any opportunity. But you did talk about a bit of a cycle where we've got, the pain avoidance and the activities that some patients kind of then start to avoid to eliminate pain. And I think you talked about, thought beliefs, emotions, how the body responds, and behaviors. Can you extend on that more? Because I found that fascinating.
Okay, so two things. One, When I say infuriating, I am infuriated by how pain is treated and how it's treated as a biomedical problem exclusively. And the fact that all of us are trained in this, either physical or emotional sort of rubric, that just drives me nuts. But I actually think there could be a lot more overlap. And I'm all about, allied health partners using some of these strategies from CBT and mindfulness-based stress reduction and ACT. I don't think that's stepping out of your zone. If you're pretending you're a psychologist and you're not, that's a problem, just as me pretending I'm like a manual therapist would be a problem, because I don't know what I'm doing. Like, I can give a great massage, but I don't know what I'm doing,
Yeah.
So I think we can work together more and use each other's stuff probably more than we do to really bridge that gap and talk, and also talk more and be in conversation more. But what you're referring to is, I'm a big believer in cognitive behavioral therapy for a lot of different things, for pain, but also anxiety and depression and trauma. And those things live together when it comes to chronic pain. A lot of people with chronic pain have medical trauma, and there's this significant overlay between depression and anxiety and pain. So CBT has been shown to be really helpful for all the things, which is why I like it. And CBT just says this thing where your thoughts affect how you feel emotionally, affect how you feel physically, affect how you behave or act. And it's sort of the circle, but not really, because everything affects everything in every direction.
Yeah.
And I think that's an important model when we think about pain, because we often skip emotions and we skip thoughts and we focus just on the physical body. Yeah.
And even with those thought beliefs initially, I mean, we see it in private practice. We've got a patient who comes in to see us and they feel like they're broken and they want to be fixed, or they feel like they're never going to get better. I mean, so much of that is mental, and yet we're trying to deal with the physical side and trying to remove that pain away. Now, you can treat them week after week, and we get into this downward spiral of this maintenance treatment that is assumed then to be unethical, because if we're not fixing something, then why are we having patients come back? I mean, can you please help us understand that a little bit more? I mean, if we have somebody coming back and we're genuinely supporting them through activities of daily living, but we're not fixing them, should we be referring them off to a psychologist, or are we helping break down those avoidance behaviors and addressing the emotional stress and the anxiety and the mood that they're feeling just by having a conversation and just by being present and that personal contact and touch and getting them out of bed, motivating them to stay active, and that physical sensation is one component of it. But I think surely we are doing more than that, and we've got a role in that.
You just asked so many good questions at one time, and I agree with you. Yes, it's very important to supply support and motivation. 100%. Totally. That's what I do as a pain psychologist also. And what you were saying before about people thinking they're broken and they'll never get better, there is an abundant amount of research that shows that thoughts like that actually affect the physical pain you feel via this mechanism in the brain that I just like metaphors. So sort of like the pain gate, like Melzack and Wall's pain gate, or like a pain dial. You imagine the volume knob on your car stereo that gets turned up, and negative thoughts literally physically amplify pain. This is like a known thing throughout. So if you have patients who are coming in who are saying things like, I'm broken, I'll never get better, 100% you can target that. Definitely. Okay. And it's really important. I think this is just my opinion. I don't know if everyone would agree with me, but I do not think it's rocket. Yeah. I don't think it's rocket science. Like, I don't think we should be so territorial and possessive of the skills that we have. I think we should share them with other health professionals. And I would love to know, I've taken so much from the PT literature personally, like Mosley and I read all those papers. I love that. I think they're so important and so great. So yeah.
And so where does that line, because there's obviously a bit of a clash and a dissonance between overtreating and seeing patients too much, and then undertreating, which can actually be as detrimental to a patient if you are not rebooking them and not seeing them. How do we, and particularly like young graduates who don't really or can't piece together a prognosis for pain, particularly when there is that biopsychosocial pattern that is heavily invested into that person's life, how do you know when you're overtreating and undertreating, and when you should refer off to a psychologist, and when you simply are doing exactly what the person wants, and that's just by being there for them?
I think that's a really good question that everybody struggles with, but the piece that you're asking about that I want to address is when should you refer? So if you have a client who you think or has told you is struggling with anxiety or depression or discloses some trauma, I would say refer them. I also am really biased. I genuinely believe that everybody would benefit from having a therapist. I really genuinely believe that. And the way I talk about that, I actually stole this from a friend who said, I'm sort of sick of everybody talking about how many miles they biked and how many triathlons they've done. And imagine if everybody talked about how much they worked on their mental health as much as they talked about working on their physical health. Like, imagine how different the world would be. And I really love that. Like, yes, it's important to run and take care of your body and also your mind, especially when it comes to pain. So I actually really believe that everybody would benefit. I don't know if it's an undertreating or overtreating thing, but I do really believe in like that biopsychosocial approach for sure.
And so what about at the moment? I mean, are there any apps or that, to help people through this time? Because obviously it's a really uncertain time and people are more anxious at the moment. People are afraid of the instability and they don't feel safe and secure in what the future even holds. Is there certain apps that we can recommend now? I mean, are there certain innovations in this space that we could be recommending to our patients that even you use personally?
So I know that there are a couple of chronic pain apps that have popped up, but I don't know that much about, I don't know enough about them to recommend them. But I definitely all the time send my patients to apps that help them relax and breathe and use mindfulness and use relaxation tools and use self-soothing mechanisms. So there's Calm and there's Headspace, and there's an app I like called Stop, Breathe, Think. There's a couple of others that I'm not thinking of right now, but I actually put together a website actually just because I have no memory. My memory is a sieve. I forget everything. So I just put it all in one place so that I could say things like, oh, just go to the website and there's like a list of apps and stuff. But I very much believe in giving people coping tools. And if they're ready to use them, I find that they will. And if they're not ready, they're not ready, which goes back to your question also, like, how do you know when is too much and how much is not enough? I think patients guide us and they let us know what they're ready for and when. But I like giving people resources so they can use them if and when they're ready.
And I think in times like these, vulnerability is the key, isn't it? I mean, no one's exempt from this, are they? Everybody's going through stresses. And I think sometimes whether, if you're in a position where you're not necessarily needing to refer somebody off, but just talking, just being present and just actually going through the emotions and going through the steps and stages, I think is useful in itself right now. How are you finding that communication is changing right now?
Yeah, you bring up, I was saying before that I totally feel isolated and worried about the future and who knows what's going to happen. And is this going to last 18 months? Because, that's when there will be vaccinations. Nobody knows. And I think this is a terrible time for people with chronic pain, even like provider friends that I know are struggling with pain flares because, of course, the brain and body are connected 100% of the time. So if you're panicking and freaking out and feeling stressed and depressed, your body is going to be responding. So I totally just forgot what you asked me and I went down like 7 different rabbit holes. What did you just ask me?
It's more that how communication is changing, but I think I love what you're saying about fears. I mean, as somebody who deals with pain all the time, and obviously the physical pain and the mental pain are really intertwined at the moment, and from people dealing with physical pain like we are all the time, what would you love to see more of right now? Like if you had a message to deliver to everybody in closing, what do we need to do? What can we all be doing better?
Yeah, I think everyone really needs to be taking of the stress and anxiety and sadness and grief that's happening right now. Just honor that it's real and that of course it's going to affect your body and find ways to manage it. So I also read a really nerdy article for Psychology Today. It's a column actually, but just wrote an article on like managing and navigating the totally normal anxiety contagion that none of us have ever experienced before. We've never been through a pandemic, and I think all of us as providers also can help our patients really navigate the stress and anxiety of this. And I don't think you need to be a therapist or a psychologist in order to do that. So just honoring that the brain and body are connected and that if you take care of your emotional health, you'll take care of your physical health, and just providing resources and support and communication. That's what I would say.
And just that we all have a really valuable role to play as health providers right now at the moment, and just embrace that for what it is. I've read a lot of your work. I've read a lot of your articles for Psychology Today. Where else can anybody find your stuff if they want to hear more about you or more about your work? Where can they go?
That's really nice of you to say. I value that a lot. I'm not actually really good with compliments, but I really appreciate that. I have a nerdy website. It's just my last name. It's zoffness.com. And there's a ton of resources on there for providers because, like you said, I think communication and collaboration is really important. So there's resources for patients, but also providers, books and apps and websites and just a ton of stuff. The Psychology Today column I write is called Pain Explained, and there's a bunch of pain articles in there because I love going down that rabbit hole and thinking about creative ways to teach stuff. I've written 2 books. So one is the Chronic Pain and Illness Workbook for Teens, because there's just so few resources for youth, and that drives me crazy. I feel like they're sort of forgotten. And then the adult workbook's coming out supposedly in October, but I don't know about that. And it's called the Pain Management Workbook. So other places, I'm on Twitter at Dr. Zoffness. I really like chatting with people. I'm not a social media person, but I'm learning. So yeah.
Wonderful.
Yeah.
Well, thank you so much. Thank you so much for your time. I know the time difference over there is getting quite late for you, so we'll definitely let you go. But I just wanted to thank you so much, introduce you to everybody, and yeah, I really want to recognise the wonderful things that you're doing for allied health, and thank you very much on behalf of everybody.
Thanks, Jade. So nice to meet you.
Thank you. Bye.